Mecklenburg County's Health and Human Services Agency is a group of dozens of services that form the core of what counties in North Carolina provide its residents. Departments in Health and Human Services Agency include the Department of Social Services, Public Health, Community Support Services, and the Department of Community Resources. Collectively, they serve hundreds of customers every day and thousands each week. With 1,300 employees, 5 divisions, and $188 million annual budget, the Department of Social Services anchors and manages many of the programs and services in HHS. DSS's responsibility begins with youth and family services. On any given day, nearly 600 children are in Mecklenburg County custody. YFS meticulously and painstakingly investigates and manages each case, keeping the welfare of the child in the forefront. On the other end of the care spectrum, DSS Services for Adults transports, feeds, and helps elderly folks stay healthy and independent. Working with Park and Recreation, many attend classes and programs at county recreation centers and eat together at multiple locations throughout the county. Though mental health services are managed by the state, DSS's Behavioral Health Division helps those with mental health issues find state and local programs and get the help they need. DSS also manages economic benefits, food and nutrition services, Medicaid, Work First, rental and utility support, child care, and multiple other federal, state, and local programs, all designed to help residents maintain enough resources to take care of themselves and their families.
From customers, we hear a lot about thank you. Thank you so much. We know that they face harsh realities in our community, and we just want to be that safety net of services to help them get through that harsh reality at the time.
Mecklenburg County Public Health provides 41 services countywide. Clinical services are found at the Neil Cooksey Health Department on Billingsley Road, the Northwest Public Health Department on Batesford Road, and at the Community Resources Center at Valerie C. Woodard. Nurses, doctors, nutritionists, and other health workers run the clinics, providing testing and education, and helping those who need it obtain treatment. WIC, Services for Women, Infants, and Children, are also provided at health offices on Executive Center Drive. Other public health staff work nonstop trying to educate, prevent, and manage the impact of communicable diseases in the community. At the same time those services are being provided, dozens of public health environmental inspectors fan out across the county, inspecting restaurants, hotels, swimming pools, schools, tattoo parlors, and other places the public eats, plays, and stays. Each inspection follows stringent state and local health inspection guidelines, and the results are posted online and in the establishment. In the Charlotte-Mecklenburg school system, public health nurses are in every school, providing immediate medical attention and health information to students and their families about staying healthy. In addition, other services help coordinate care for children and pregnant women, services for children and adults with disabilities, and the needs of children who have experienced trauma. HIV testing, including prevention, treatment, and support services, are also provided by the Mecklenburg County Health Department. There are still other programs that work to improve access to healthy food, increase physical activity, and prevent or decrease smoking. We also partner with the faith community to improve health conditions in their communities. Community Support Services was formed in 2006 to leverage community partnerships for better customer service to Mecklenburg County's most vulnerable residents. CSS has 3 divisions and 169 employees located in more than 20 locations throughout the county. They provide direct and indirect services to customers. The Homeless Services Division provides assessment, outreach, and case management to individuals and families who are homeless or working towards housing stability. Veteran Services provides direct assistance to veterans of the armed forces and their families or survivors to grant them initial benefits they've earned, or preserve existing benefit entitlements from the U.S. Department of Veterans Affairs, the Department of Defense, the State of North Carolina, and/or Mecklenburg County. CSS's 3rd Division, Prevention and Intervention Services, addresses domestic violence, substance use, and violence prevention. Services in this division include individual and group counseling for adult survivors and child witnesses of domestic violence, the NOVA Intervention Program for domestic violence offenders, the Supervised Visitation and Safe Exchange Center, as well as dual substance use and mental health treatment for residents of jails, shelters, and community members living with HIV. Lastly, the division works to reduce violence through youth and community-focused prevention initiatives.
We serve some of the most vulnerable populations in our community, whether it's a veteran who's unsure where to go for their benefit entitlements or a family that may have been completely disarmed due to domestic violence. We're here for them. And we're not only here with services, but we're here with access to people that truly care. And I think that's awesome.
The newest Health and Human Services Department is a combination of services you've just heard about. Through the Community Resources Center, the Department of Community Resources brings together many health and human services agencies under one roof, creating a one-stop, convenient experience for customers looking to access services provided by DSS, public health, community support services, including child support enforcement, park and recreation, and others. The first of 6 planned CRCs opened last fall at the Valerie C. Woodard Center on Freedom Drive. Since opening, more than 50,000 customers have received one or more services at a single location. As they enter, customers are warmly greeted by staff and directed to kiosks, where they sign in to receive services.
What we've heard from customers who've visited the CRC is exactly what we were hoping, and that's that we provide a welcoming environment to services when they walk into the CRC, that they have easy access to services, and that we're educating them on the different services and programs that they can apply for, not just here within the CRC, but also within our community. And so they appreciate also the excellent customer service that our staff provide here at the CRC as well.
The departments that make up the Health and Human Services Agency are the core of programs the county provides the community. Whereas the City of Charlotte provides hard services like police, fire, trash pickup, and street maintenance, the county provides soft services like DSS, health, community support, veteran services, and child support enforcement. The directors of each Health and Human Services Agency are now available to discuss your priorities and answer questions.